This episode is made possible by our sponsor, Landmark College, the college for students who learn differently, offering comprehensive supports for students with ADHD and other learning differences, both on campus and online. Learn more at lcdistraction.org.
I'm René Brooks, and welcome to Distraction. I am an ADHD coach, a writer, and founder of the blog Black Girl Lost Keys, a website that was created to help share the Black experience with ADHD. I'm really looking forward to sharing some new creative voices that you haven't heard, some new ideas that maybe you haven't considered, and really just bringing you into Black Girl Lost Keys land. So I'm really excited to be guest hosting Distraction during the month of October while we celebrate ADHD Awareness Month. Joining me today is Inger Shaye Colzie. Inger Shaye is an ADHD leadership coach and a psychotherapist who specializes in working with Black women in professional careers. Inger Shaye and I are both ADHD coaches, and we're friends, and we frequent a lot of the same ADHD circles. So we talked about advocacy, about how to communicate with your healthcare team, about how to advocate better for yourself with your family and friends. There's a lot of good stuff in there, so I'm excited to hear what you think. Thanks for joining us, Inger Shaye. It's always a pleasure to run into you again.
Oh, I love being here with you. My ADHD sister.
That's it. We're getting through it. So we had a conversation where we were talking in a support group about how people have certain rights and responsibilities as a patient. And it seems like a lot of times people don't know that they have options like that. And I thought it would be cool if we sat down and had a talk about, what we have to accept and not accept from our providers, what our responsibilities are as patients, and just how to use that information to have a better experience as a patient.
Okay.
Do you want to talk as a therapist first or as a patient first?
Well, I guess the thing is, because I'm both, it's hard to separate the two at times, right? So it's interesting because I have, told my story many times. I didn't know I had ADHD till I was a lot older, and I had been a therapist for 15 years, and we didn't get a lot about ADHD when I was in school. It's about a paragraph, and it was about little white boys falling out of their chairs. So they never mentioned anything with adults. So I didn't know that it would pertain to me. I thought it would only pertain to my child. But being a therapist, when I found out I had ADHD and really dug in and found out all the different ways it affected people, especially women, I had to go back to my clients because many of them had ADHD and I did not diagnose it. And I had to then turn around and change their treatment plans. Right? So I had to apologize and say I didn't know, but now I do and will change. And I find it interesting because I'm sure many people have not been diagnosed because if you don't know about it and we're not getting a lot of information about it in school, then how would we know? When somebody presents and they say, you know what, I've had all these difficult times, maybe a lot of trauma, because ADHD brings a lot of trauma, and I feel depressed, I feel down on myself, or, I'm always shaky and I feel anxious, then we're going to diagnose you with depression or anxiety versus looking a little deeper to say, why are you depressed or what could be causing the anxiety, and looking through the lens in the opposite way, because many clinicians and therapists were taught to do it the other way. At least we were when I was in school. I think things have evolved a bit, but many times when we're able to address the ADHD, then we're able to better address the depression or the anxiety or some other things, because there are a lot of times there's comorbid conditions. And when you come in as a patient, it's like they expect you to be able to differentiate these things. This is why I went to school, but it's just not so easy. And I really beg people to take the time. Make sure that when you're speaking to somebody that might be diagnosing you, or you're recounting things that are going on, that you take a bit of time and really dig in and explain. So it's easier for the clinicians to diagnose you correctly, because many times it's like we're just hearing a few buzzwords, and then that's what we get. And then we give this diagnosis, which isn't really helping you. And we're in this to help you. And I think that that's a really important distinction. I find that many times, it feels like if you make a mistake that people will say like, well, you're not really trying to help me, where it's not the case. Like you don't go to school for these things or spend all this time not to try to help people. So it's working in, conjunction with your clinician, as opposed to just having them on high telling you what to do, or you kind of coming in combative if you don't hear what you want to hear, like working together to see if you can come to something that really makes sense for you and for the clinician also.
I like what you said there about working in conjunction. And while we're talking about working in conjunction, that reminds me of the fact that Inger Shaye is also a coach, and they talk about collaboration and coaching. Is that a similar relationship that you should have with your therapist, that same sort of spirit of collaboration and participating in a mutual goal of your overall wellness? Absolutely.
Being an ADHD coach, it is an interesting lens to have it, where it is a collaboration. But I also use that in my therapy, and I feel as though you should use that with your psychiatrist or any other person that is helping you along your ADHD journey, because it's your life. It is your life and it's your experience. And, when you work together with somebody, that's when you're able to move forward. When it's just having the psychiatrist kind of tell you what's going on, or for you to just say, hey, they don't know what they're talking about, or maybe not, sometimes going with the flow a little bit to see if it is what's going on, then how are you going to get down to really the nitty gritty of what's going on and to be able to be helped? Because at the end of the day, all of us are on the same team. We're rowing in the same direction. We want you to be able to live your life well. I will tell you, you can live your life well as a person with ADHD, but you need to be able to use all of your resources and be in step with them. But I will say, if you are with a clinician that you don't feel like you can have a collaboration with, that you don't feel comfortable with, then it is your duty to find another professional to work with. I know it's not so easy. I will not sit here and say like it's so easy to just find somebody else, especially if you live in a rural area or your funds are limited. And with these days and times, I know a lot of clinicians and psychiatrists are really filled up, myself included. But it still is, the onus is on you to find somebody that you can collaborate with, because when you can, you'll find that your treatment plan works better for you. And when it works better for you, it works better for a clinician. And then that way, everybody's happy. So, it's definitely a collaborative effort.
What are some signs that people should look for? Like, what does it look like when it's working well?
When it's working well, there's smiles, right? When it's working well, you can feel as though you can come into your clinician and say, this is my experience. And your clinician will listen and just listen and not necessarily put their different thoughts and feelings on what it is that you're saying. Like, give you a second to get all of your thoughts out. And then, you will also listen as they say about the things that they feel might be going on, or they should ask a lot of questions. They should definitely be curious. And at the end of your time together, and I know, especially like with psychiatrists, it's like 15 minutes, right? Unfortunately, that's the way of the world these days. So it is a lot to get out. But take like one story or take one particular thing that's going on, like write it down so that you're sure that you get all your questions answered, or you say things that you want to say, and then give the clinician a chance to answer. And when you have that kind of back and forth, when you can have it where there isn't just sometimes a definitive answer that both of you don't kind of come to that conclusion, then to be able to say, hey, we need to make another appointment, or let's try something, and then actually try it and then see if it works. If it doesn't work, to be able to actually report your findings back and then have your clinician work with you. If you feel like they're not listening or they're not taking into account what you're saying, you have that kind of creepy, eerie feeling like they're not listening.
Right.
Like, I feel like you will kind of know if you feel like you're talking at someone instead of to someone. And yes. I think that is the difference. That's when you know that it's working. And sometimes I will say, you've got to be patient. These things take time. These things are very nuanced. And it's not like, I think many people think, it's like you break your arm, you go to orthopedist, they set it, you come back a few times, they take an x-ray, it's better.
Right.
Mental health is the opposite of that.
Right.
Mental health is something that's ongoing. It's chronic in the fact that it is ongoing. So it's not something that's like on and off. It's something that you're going to be dealing with for your entire life. And that is fine. But no, at some point, you're going to need different levels of support. But you will need levels of support your entire life. So to actually kind of be with that as a fact for you, and then going into all of the different times that you are meeting with, therapist or psychiatrist, that it's okay, that we're going to be doing this for the long haul. So if it doesn't go right the very first time or a few times, or we have bumps along the road, that's okay, because there's going to be other times to address it, because this is something you're going to be addressing for the rest of your life. And for me, that makes it helpful, because it isn't like just, we get one strike at the bat, and that's all we get. Yeah. Where it's like, you can come back. You can let these medications work. If you're going to take medication, some of them take time to work. And some of it is putting these experiences into your life. Like, to me, this is the coach aspect. You're going to have to take some of the interventions, medical or not, and then work them into your life, and then come back and say how it worked for you. Because that's the only way we know what's working. So that's where the patience comes in, and knowing that you're going to have different experiences for your whole entire life. So you just take your time, take a breath, and know that it can be figured out. We can figure all of this out.
I love that, because you're right. Like, even in general conversation, we know how it feels when we're heard, and we know how it feels when we're not heard. And I think when we walk into a clinician's office, sometimes we're just waiting for them to perform a magic trick for us. It's like we feel like we give them a few symptoms and they'll go, yes, I can sense that you're feeling like this. Like, this isn't reading cards. This isn't being psychic. We have to give them the information. I know, like, a lot of times when we're having these discussions and people are saying they're dissatisfied with the care they're receiving, like, they'll say things like, I told the therapist that I wanted to come back to this, and they never gave me a chance to come back to it. And I think that's one of the things that prompted our discussion. Like, they're not going to remember what you want to come back to. Like, even with careful notes, you come in and you may say, oh man, I got into this fight with a relative and this, that, and the third, and you're going all over that part. And maybe they don't come back to what you talked about last week because you came in with a new present need. So I think one of the things that we have to be careful to do is we have to remember what we said we wanted to talk about, if that's really important. And we have to kind of prioritize what's the greater need, to talk about this thing I said I wanted to talk about next week, or to talk about maybe the disagreement I had with somebody. Maybe I'm just venting about that and I can come back to that later. And it's difficult for us as people with ADHD to prioritize that because we have issues with now and not now. So maybe that current issue feels more important, but then the problem that we said we want to come back to falls by the wayside, and then we're frustrated and we're blaming the therapist. Maybe that's not the therapist's fault. And it's not our fault either, because we can't help the way we think. We just need to find a different way to keep track of that.
Yeah, it's interesting when you use the word fault. I don't think it's anyone's fault.
That's it. It's not.
Things happen. right? We're all human, and that's life. So even, like I said, even with careful notes, we may not have time to glance at everybody's note beforehand. Exactly. And many times we can remember what's going on, but my philosophy is you meet the patient, the client, the person where they are.
Yes.
And when I'm meeting you where you are, if you are in a different space, and I'll ask you, like, what do you want to address? And if they want to address something that's not what was in the note from last week, then we're going to address that first, right. Because that's where you are right then. And we can go back to the things that you wanted to address before, and sometimes those things are no longer important.
Yes.
Right. You might have gone off into your life and kind of worked that out. So I do think that you need to have a reflective practice and kind of put a period to the end of those sentences. But it might not be so top of mind as it was last time. And you're right. Having to prioritize isn't so easy. However, I always suggest that people, like, you keep notes.
Yeah.
That you keep a note or two, because I'll tell people that many people want to talk about something right when the session's ending. And it's like, okay, because we don't have time to really address that. But I'm like, we'll put a pin in it. Like, and I'll ask them to bring it back next week when I give some type of field work or homework. I'll ask them to bring it back next week. And I also request that they're, honest about what they didn't do, or how it went. That way we can address it. But, I do feel as though if you take a few notes during the week, and not a lot, just like jot down a couple of things, because it's hard to remember from, every week. And then bring that in with you, as we do, like in coaching. There's a note that people bring. They fill out a form, and it's like, what happened during your week, and what do you want to talk about? That way they can address, like, the homework or something that was top of mind, and maybe what they want to talk about that might be, similar, or something that's different. But then we have a direction, and it makes it a lot easier than sometimes chasing people's brains around, as I call it. And it makes it so that with the direction, you really do make better progress. So when you can take a few notes and put us on track, like I said, we are human. If you say, hey, I want to talk about X, Y, and Z, your clinician should be flexible enough to be like, okay, because we're going to talk about whatever you want to talk about to make sure that you're getting the services that you need. It really is about meeting you where you are. I do want to bring up, René. So it's interesting. I'm a clinician and I have ADHD.
Yes.
And with that, sometimes the way therapy is set up, especially like for people of color, I think that a lot of times they feel like it doesn't work because it can be where the clinician's like, okay, we were just working on this thing, that we were talking about, and that's all we're working on.
Yeah.
And if you're going to follow sometimes the strict protocols of many of these different ways that therapy has been taught to us, that can happen. And to me, that doesn't serve us, especially Black people, because that's just not how we work. Work where it's like, okay, this is what's happening. This is my life. This is what's going on. There's a whole lot of nuances that go on. And to just sometimes go in that straight linear model that's taught to us from, old European standards don't work for us. And I think that's why a lot of Black people go, therapy doesn't work. Or if they tried, I tried it, that didn't work.
Yes.
Right. So I think it's incumbent on us as clinicians to, kind of rework these models a bit to work for us, because our mental health is really at peril. The suicide rates are going up exponentially. We can see all the homicides, the pain and the trauma that this pandemic has brought, and the pain and the trauma of being a person with ADHD, the pain and the trauma of just being a Black person that walks around our skin with the generational trauma. It is real. It is palpable. And when you don't address it in a way that is really talking about those things, then we're not getting to the root of it. And
I completely agree.
That's sometimes what's happening when we were speaking about being able to connect with the clinician, like having it be a collaboration. So I think it's incumbent on us too to be flexible, right? Not to just be in those models, so that the other person does feel comfortable, and it is a collaboration.
I love that. Like, I know for me, for several years at the beginning of my mental health journey, I was with a therapist who was white, and I wanted to dig into family trauma, and through no fault of her own, she did not get it. So there I was trying to say, this and this and this. And one of the things that I feel like is a value that a lot of us hold culturally is really, you respect your elders no matter what. There's a certain way you can't push back on them. And for me, that created an issue with boundaries with them. And as I was trying to articulate that, she was just kind of like, well, I mean, just blah, blah, blah. And I'm like, no, you don't understand. That's not how we talk to our elders. We don't direct them to do anything. We don't command and demand things from our elders. That's not the way we do things. So it wasn't until I was able to get with a Black therapist that I was really able to be like, this is why I'm mad. And for her to be like, oh, girl, yeah, I understand exactly what you mean. And there was like, as soon as she said it and she got it right away, I was like, this is why it never worked before. This right here, because I just needed you to acknowledge that so I could move on and we could get into the meat of what the real issue was, instead of me going session after session after session trying to explain, this is why I'm stuck. Here's where the barrier is. This is why I'm stuck. No, you need to know this. You need to know that. You need to know this. So it's not that the therapist, she wasn't a bad therapist. She needed more education in that particular area. And she didn't know what she didn't know, which is another conversation. Like you said, when you were in school and you were learning that about different things, ADHD wasn't really a factor. How do you, as a clinician, like, to me, that's not a criticism on clinicians. That's a criticism of the way that we're educating clinicians. Like, how do we, like, I know that you guys do continuing ed, but really, like, that's something you select as far as what you're interested in learning. Like, how do we standardize something like that more and say, no, everybody needs to cycle back in and learn more about these things, especially like ADHD is not uncommon. Depression, anxiety, like these things are constantly flowing and different definitions and ways that it manifests are being updated. How do people stay current?
That's actually very interesting because sometimes when I speak with younger clinicians, they have a little more of a grasp on it. Still, there is so much misinformation out there.
Right.
And you're right. We do get to pick our own continuing education units. I feel it's incumbent upon you as a clinician to do that.
Right.
Right. To things that are important, the things that you feel like you might be missing or things that you might just need to kind of, re-up on. To be able to do that, that's what the continuing education is for.
Yes.
So to be able to do that. But, there's a thing where with ADHD in particular, because that's what we're speaking about, it manifests in so many different ways that it makes it different. And sometimes, and especially when you have clinicians that have ADHD, you could miss things or things ring so true that you know it when you see it.
Right.
So it really is incumbent on us to be able to do that. But also, it's the fact that there's not a lot of research.
Yeah.
As long as ADHD has been around and it's been talked about since like the 1700s, it's had different names over the years, but it has been. And there's definitely not a lot of research as it pertains to women and Black women.
Yes.
And there's just a little bit of research about like young kids, young Black kids. So the fact that there's no research, it's hard to quantify. And when it's hard to quantify, then it's hard for them to have a lot of lessons around it. Right. I find I get a lot of clients through my ADHD coaching that are late stage diagnosis. And, you and I always have that little joke, like your late stage diagnosis is 25, my late stage diagnosis is in my 50s, right? So when I have people that are coming like a little closer to my age, that they're like, how did it get missed? Like, how did it get missed? And I'll say, well, when we were really younger, it wasn't, they just didn't know anything about it. Like, for me, it just wasn't even like a consideration. But I don't think anybody knew what it was around where I was. And then even later on when they didn't really think it was about adults and stuff like about women. And when you were a kid, a girl, if you had inattentive ADHD and all your anxiety went inward, and you were quiet, and maybe you were able to pass your classes, or even if you were a little for activity, they would just account it to, she will grow out of that. We're going to teach her to be a good girl. Or sometimes, being praised about because when a girl does something like if she's in STEM, where she stands up some things that are some male attributes, and it's like, oh, look, she's being very empowered, right? Where sometimes you're taking some of those male attributes, and it's because it's the way your ADHD is running that people miss these things, right?
Exactly.
It's like,
that,
yeah, I'm
like
really
you're
great
boisterous, you're able to push through,
Yeah.
you're able to push forward, you're, girl power, which is great. But I agree with you. It's like we're being masculinized almost. I don't think that's a word, but the things that we're doing that are very much us are being attributed to male qualities. And because we live in such a heteronormative society, the idea when you see a girl doing something that a boy is supposedly supposed to do, the next motivation is to root it out and make you stop being like that.
Yeah, to make you stop, or when you're heralded for sometimes some things, and it's like, no, really, that is my ADHD running my anxiety, to do some of these things, right? So it can be either way. It can run where your anxiety turns in, and they tell you to be a good girl, like don't do those things, because you must be nice. Like I said, some of these are cultural norms, and that's why you need a culturally competent provider, things like that.
Say it again.
A clinician may miss. Culturally competent providers, they will not know and they do not see it. They will not know, like I said, about your elders, or they will not know that, the superwoman trope, like, we're strong Black women. Yes, we are. But, I have to run everything, and running everything, trying to do all of those things with the ADHD I have. And then if my house is unorganized, the way that that's going to look. And then you wonder why I have anxiety. And you present with anxiety as opposed to presenting with looking at, let me look further back. Oh, why are you unorganized? And why is this organization the thing that's caused the anxiety? Oh, maybe it's because you have ADHD. And so that's why it's like having somebody who's culturally competent, because maybe if you are, a white person, it's not that you want to be disorganized, but just not looked upon the same way. When you're disorganized as a Black person, you could look like you're dirty, or you miss out on a lot of opportunities.
That's it.
They think that you can't handle things. And
feeding back into that stereotype about us being disorganized, lazy, and unkempt. So some of us then overperform that. And then you've got this little kid who you're trying to teach to also overcome that stereotype, and they can't. So then you're scared as a parent.
And then that's a whole other thing, is I'm a parent with a child with ADHD.
Listen, I was wondering when you were going to bring it up, because I'm like, man, you got a lot of hats to wear when you're sitting. Sometimes you're sitting in the therapist seat. Sometimes you're sitting in the patient seat. Sometimes you're sitting in the mom seat, and you're all three of those things. No matter where. Wait, we're forgetting a seat, the coach seat. You in 4 seats. No wonder you don't get tired. You not tired?
I'm ADHD. I'm not tired.
That's right.
You can't just what's going on.
You got the energy to keep it going.
Thank goodness. So that's why sometimes I'm like, thank goodness I have ADHD, because there's a lot I gotta have to do, lots to handle, and with ADHD I can do that. So it is interesting. We're talking about like advocating. Advocating for me was even less for my son in the realm of therapy or psychiatric, is more in advocating in school.
Yes.
Right? Because, they look at him as just more of a discipline problem, instead of actually, when he had a diagnosis of ADHD, just dealing with that. So they never looked into the ADHD at all, which was always so puzzling to me, because I was like, you guys have been educators for 10, 20, 30 years. And I've had a kid for, 10 or 12 or 15 or however old he was years. And how do I know more about ADHD than you do? And that's where I got a lot of my education, even as a clinician on ADHD, when I had to dig in it first for my child. Yeah. And I do hope that parents do get a lot of education, right, about what ADHD is, and learn how to advocate, like bring in, like, ADHD is a real condition. Here are some studies, and some studies that are, peer-reviewed studies, not just something from a regular article, because even though they're great, sometimes you need to bring in something where they can say, like, this is official and real, even if they don't think it. It's to use the other articles to be able to come up with a strategy that works for your child.
That makes perfect sense.
and bringing that and advocating in that way and being prepared to sit at a meeting, with a lot of different people, educators, administrators, and it might be just you or you and your husband, or, hopefully you could get an advocate or an attorney if you would need one, but to be able to know that that's what's going to happen and come in with all of your education, with all your, everything, your ducks in a row, so that you can have conversations that make sense and have accommodations that you would like that they can provide. And if they give you pushback, to be prepared to push back. It's funny, we can be so, we can be like a dog with a bone with certain things. And certain times, we just go, okay. And, we just can, feel like so intimidated by things. I say this is the time when, that kind of stubborn streak that most of us have, to use that, right? Yeah. To use that for your kids, or to use that for you if you need accommodations, maybe at work or, in different places where you might see that there's something that you need you're not getting. Instead of turning like inwards or saying, oh, they're not doing anything for me, it's to use that stubborn streak, because most of us have it.
Yes.
Go, no, you don't have to be rude and mean, but to be like, this is what I need, or this is what my child needs. It's, it's doable, because most of the things that we need are not things are something that were really expensive or where we're asking people to actually bend over backwards. It's usually things like a quiet room. Yes. Things like giving your kid a little extra time for tests, or having somebody like maybe take the notes. It's if you're at work, it's like, can you send that to me in an email?
Yes.
So I don't have to try to remember what you said in the meeting. So it's usually just things like that. But many times we don't want to ask. We get really embarrassed. We don't want to advocate. And I say, take that part of you that gets so mad about some things, take some of that. If you're somebody that happens to have rejection sensitivity dysphoria, take it and flip it around and be like, oh yeah, I feel bad, but now I'm going to take that and make sure I get what I need so I don't. You can flip like a lot of these thoughts and behaviors from the other head.
As Black women, so many times we're like, I'm just going to do it myself. And so we're reluctant to ask for help because of that. Like we feel like maybe we're not going to get the help if we ask for it. So we're not even going to ask. We're just going to try to figure out a route around it, because we still have to get what we need. But it's almost like, I feel like this is tied into how tired and stressed some of us are, because even when there are resources available to us, sometimes we still feel like that's not for me. I can't trust that. I'm going to figure out a way to just do it myself. What can we do to kind of work around that?
Yes, that's definitely, it's part of, what we have grown up with as a Black woman, that we're supposed to, not even that, we're supposed to do it ourselves.
Absolutely.
Like we're supposed to know, and we're supposed to know how to do everything and make sure we get it done. And a lot of times we're looked down upon when we don't get it done. And with ADHD, like in a timely fashion, in an order that makes sense to other people.
Yes.
So we have those things that do weigh us down. And many times we do look at things and go, well, that's not for us. That must be for white people. Right. Because we've also been brought up like that, to say that can't be for us. I think therapy gets into that box.
I've never felt more like I was a fish out of water than I did when I I wasn't literally laid down on a couch, but when I sat there the first time, I was like, what am I doing here? Have I really let it get this bad? That this is like in my mind, I'm there like, this is not, you're not reducing yourself to anything by going. But I was like, is this how far you've come? Like, is this how low you've gotten that you had to come here? You don't belong here. And it's strange to me, not strange. It's pretty common, but I think this year I've experienced a lot of personal tragedy. And it's made me realize how many places in my life where I still am in that idea of I have to do this myself, or I have to keep this hidden, or I can't ask for support here. And how much that's reinforced by the other women in my life, because there were things that we were doing. And I'm like, hey, this is not human. Like, we can't handle all of this. And one of them looked at me and they were like, why do you always want to involve somebody else? Why can't we just, keep this in-house? And I'm like, because we literally don't have the capacity to handle this ourselves. And I'm not going to work myself into an early grave just because it makes y'all feel better for us to, like, we don't get no merit badges for that. I've never gotten an award for it. I've never gotten anything but more tired. But here we are still committing to doing things on our own. Well, not me, because I'll tell you, when you're in enough trouble, like I learned it out of desperation, because it was like I came to the end of myself. It's not that I wouldn't have tried to do it. I literally could not try to do it. And it was like, well, hell, I'm going to have to ask for help. And this is really uncomfortable. What does that even look like for me?
Yeah, we're not used to asking for help. And of course, I've been told, that's nobody's business, right?
Yes.
That's nobody else's business. That's your business. And why would you let it, have all your stuff out in the street, right?
Because if you expose yourself, you're in danger.
Yes.
So
I think a lot of it, we're talking about that. Yeah, you're making yourself vulnerable. And I will say some of that is a generational trauma, because, we were sold as slaves, and that DNA is still there. So, if you let that there's some type of a vulnerability, or you make it sound like, or even sometimes we make it sound like something's great, because, our kids were sold that many times we'll talk about our kids so poorly because it's kind of a generational thing where it's like, I don't want to make it sound like they were doing good.
If I make you sound valuable, they're going to come get you. They're going to take you from me.
Something's going to happen. All these things that we do in life generally are for safety. Just because they're maladaptive, they're not the best thing to do.
I appreciate you saying that, because that's what they do, don't they? Like a lot, especially particularly in the ADHD space, there's this prevailing notion, almost like we're superstitious or we're cautious to a fault. And I think that's a stereotype that needs to die. Like, Black people are not being irrationally cautious when they say they don't want to have a label placed on their child. They know how the system handles Black children, even if you as a non-Black person doesn't understand. You've got to know where your knowledge base ends and how to connect with someone who is, though it may seem like exaggeration to you, it is a very real challenge that we're facing. We have to, just like you said, that leads back to cultural competency. We're not superstitious. We're not operating out of an overabundance of caution. We know what we're going to have to face when we take something like this on. I had to, for several years, tell my family, I had to keep them at an arm's length when it came to my ADHD diagnosis, because I was tired. I'm like, look, we're not talking about this no more, because I know that you all don't understand, and I'm not going to keep explaining it to you guys. They had to watch me go and put my life back together brick by brick. When I got diagnosed at 25, I was a mess. And then once I got to the point where I was stable again, then it was like, oh, wow, you do have that ADHD thing. Well, no crap. The doctor who diagnosed me with it, who's been treating me with it, could have told you that. But I think it's something that they had to see the evidence of before they were able to accept it, because they'd never seen somebody Black deal with that. And a lot of us haven't seen someone Black deal with that. This is why representation matters. Sometimes it's just enough to know, oh, there's somebody else who has that. So now it's normalized because there's somebody who has it. You don't even have to have a conversation with them. They just exist. That's good enough sometimes.
Yeah, if you can't see it, you don't even know that it exists, right?
Yeah,
you don't know
an imaginary friend, right?
Yeah. Yeah, so that's why we're out here talking. That's why we advocate, because speaking of advocacy, we're advocates, and we're advocates for a reason, because we know how important it is for people to see Black women living well with ADHD and accepting it, right? That it's here, it's still here. I'm going to call out the tech problems that we had before we got in here. That is that's what it is, right?
Exactly.
It is that, I don't sit there and act like everything's perfect.
No, some days it's a disaster. However, and we make it happen anyway.
Yes. And you can. And sometimes it's having the self-compassion to be like, that's what happened then. Right. But that doesn't mean it has to be what's happening all the time. It's just what happened then. And to forgive yourself for the times that things happened before, because I find that too with a late stage diagnosis. So many things have happened. There's so much water under the bridge that many times that's why I think people are perceived as superstitious or stepping lightly or not wanting to tell, because the times that maybe you were younger and you were like exuberant, I'm going to do, or this is going to happen. And then you trip and fall due to some parts of your ADHD. And then, like you said, sometimes we perceive that people are looking at us and laughing, but sometimes they are, yes. Right?
Right.
It's a little bit of both. That then you will be cautious, right? You will be like, maybe I'm not going to share everything. And when you do try to tell people you have ADHD, I find that they have no idea what you're talking about. Right? Yes. They really don't. And
no, because you'd have to define it, and you feel like you're giving a dissertation to people because there's so much to explain. Like, this is the way, like, it's very, I feel like you remember those nonsense grammar rules? They're not complete nonsense, but it feels very I before E except after C when you're trying to explain to people the way your brain works.
It's funny, when I first found out, and again, I was like older, I mentioned it to my family, and they were like, what? And they just kind of, their heads cocked, and they were like, what are you talking about? And they were like, you don't have it. Not in that way where it's like, you don't have that. It was more like,
you don't have it because this doesn't look like what I think of ADHD
like I think it is. Yes, they didn't know. And that really informed me, where it was like, oh, you know what? I don't spend time telling other people that I have ADHD. Obviously I'm an advocate, I'm an ADHD coach. I coach neurodiverse leaders in big companies and entrepreneurs too. So it's not that I'm ashamed of it. It's more that for me to try to spend all my time explaining it or defending it more than anything, that part for me does not serve my time well. For me, it's more like having this conversation. Well, how do you advocate as a person with ADHD, especially a Black woman? These are some things that you can do. And to be able to have that conversation, and with people who don't know about ADHD, to say, hey, I really want to help you get my work done, or I really want to be able to do this for you, or to learn to say how to say no if it's not appropriate for you to do. Don't just say whatever. It's like, no, give me specifically what you need, probably in an email so I can get it. And then let's have some check-ins, so some accountability, and let's have a deadline.
Yes.
Because then it will get done, right?
Thank you, Inger Shaye, for joining. If you're looking to learn more about Inger, or you want to catch up with her, you can find her at ingershaye.com or on any social media network at Inger Shaye. That's INGERSHAYE. I really, really enjoyed having a conversation with my girl today. This is how we talk all the time. It's just usually we don't have a microphone. You'll get to hear a little bit more of our conversation later on this week. Distraction is created by Sounds Great Media. Our producer is Sarah Gurton. I'm René Brooks. You can find me at blackgirllostkeys.com, on Instagram and Facebook at blackgirllostkeys, and on Twitter at blkgirllostkeys.com. Thank you so much for joining me.
The episode you just heard was made possible by our sponsor, Landmark College, the college for students who learn differently, offering comprehensive supports for students with ADHD and other learning differences, both on campus and online. Learn more at lcdistraction.org.